future and life in the wake of the coronavirus crisis. Hold your questions for personalized advice on the Psychiatry Show. That's Some of Us More Tuesday on SiriusXM.3.
Whatever fantasy sport you play, and wherever you've got action, Fantasy Sports Radio is the place to be. Fantasy football coverage of the NFL draft and free agency, daily picks for the NBA and college hoops, every PGA tournament, plus fantasy baseball rankings and projections.
He has the potential to be that 20-home guy.
We're helping you have more fun with sports. Fantasy Sports Radio, Sirius 210 XM87, and on the Sirius XM app. This is an important message from the CDC about coronavirus. Listen to and follow the directions of your state and local authorities. If you feel sick, stay home. Do not go to work. If your children are sick, keep them at home. If someone in your household has tested positive for the coronavirus, keep the entire household at home. Do not go to work. In all cases, contact your medical provider. Visit coronavirus.gov for the latest information from the CDC. That's coronavirus.gov.
Greetings, East Street Nation. This is Bruce Springsteen coming from my house to yours with music for troubled times.
Bruce Springsteen, from his home to yours. Part 2.
I will be your DJ for your dancing and listening pleasure.
Bruce Springsteen hosts on E Street Radio, Channel 20. Hear it anytime on demand with the Sirius XM app. Listen at home with Amazon Alexa, Google Assistant, or however you stream in the house.
The Sirius XM app gives you everything you need to know on the coronavirus outbreak with the latest updates and advice from the world-class doctors at NYU Langone Health, no matter where you're working from. Now free to most subscribers, the app includes Dr. Radio reports on vaccine progress, travel, and testing, plus podcasts, video interviews with medical experts, and a 24/7 channel dedicated to the pandemic. Just download the app to stay safe and up to date on the go or at home.
Top doctors, leading research, cutting-edge diagnosis, powered by the NYU Langone Medical Center. This is Dr. Radio. Coronavirus, what you need to know now.
The best way to prevent the spread of coronavirus, if you feel sick, you should be staying home. You can certainly do the common sense and highly effective measures such as washing your hands frequently or using alcohol-based hand rubs. If an individual is coughing, they should cover their cough. If you're around individuals who are coughing, making sure you keep a minimal distance away is just good common sense.
Get the latest updates from Dr. Radio around the clock on Sirius XM Channel 110.
This is Sirius XM Dr. Radio. This is Dr. Radio Reports. Coronavirus.
What you need to know now.
Here is your host, Dr. Mark Siegel.
Welcome back to Dr. Radio Reports, Coronavirus COVID-19, what you need to know right now. I'm Dr. Mark Siegel. I'm the medical director of Dr. Radio. I'm a clinical professor of medicine at NYU Langone Health. I'm the author of some books on pandemics and fear of pandemics. Nothing like this pandemic. This is the worst I've seen in my lifetime, or probably anyone has here. And we're trying to deal with it, and we've been dealing with it. You heard in the last hour some really exceptional guests, Dr. Marty McCary of Johns Hopkins, and Dr. Nicole Sapphire of Sloan Kettering, and my co-host, Dr. Dan Sturman, the general head of pulmonary critical care here. And now I want to introduce the administrator of CMS, the Center for Medicare and Medicaid Services, Seema Verma. I know her well over the last couple of years. She's very capable health policy expert, and it was our honor and pleasure to have her join us. Take a listen. Today it's an honor to be joined on Dr. Radio Reports by a senior member of the President's Task Force on Coronavirus, the administrator of Center for Medicare and Medicaid Services, who I know well. It's an honor to be joined by Seema Verma. Seema, welcome to the show.
Hey, thanks for having me.
My first question is probably the toughest one, which is, I don't know if it's gotten enough attention, but we have a situation where COVID-19 affects elderly people fairly severely. It's infecting and affecting severely, and deaths occurring in nursing homes. On top of that, people with pre-existing conditions like diabetes, hypertension, and obesity, according to the most recent study in the Journal of the American Medical Association, are affected. Those risk factors are very common among our impoverished population. And on top of that, there's more and more unemployment, which implies to me that more and more people would be applying to Medicaid. Seems like a perfect storm for the Center for Medicare and Medicaid Services. So how are you coping with that?
We're doing great. I couldn't be prouder of our agency and these very dedicated public servants here. They've just been working night and day trying to overturn regulations that stand in the way of doctors providing great care for their patients. And we've been communicating every single day with different areas of the healthcare system, whether it's hospitals, whether it's doctors, nursing homes in particular, home health agencies, and trying to understand from them what kind of support they need. And then we've been on the back end getting rid of regulations, trying to make sure that they have the resources they need to provide care to patients at this very difficult time.
You know, speaking about that regulatory restraint, which you and I have talked about before, and which is one of the things I admire about you and your expertise as one of our top health policy experts in the country. Executive Vice President of NYU, Dr. Andrew Brotman, our Chief Clinical Officer, who you've met, asked me to ask you whether the regulatory restraint shown during the pandemic has been good for the overall healthcare system, telemedicine being one example, which you have now revolutionized for seniors. How much of this will survive the pandemic and go on into regular use?
Well, as you know, I've been a big advocate for regulatory reform, especially in healthcare. The reality is we just spend too much money on administrative tasks, and we need to have doctors and nurses on the front lines caring for patients, not in the back room filling out paperwork for the federal government. So these efforts just really heightened. We call it patients over paperwork, and the pandemic really highlighted the importance of getting rid of regulations. Telemedicine is a great example of that, where existing laws just didn't allow us to take advantage of the great technology out there. And right now, telehealth is providing services to patients across the country. In particular, our Medicare patients are able to get services from the safety of their home. And the president also took it a step further and said, we're going to allow providers to waive copays. And that focus on our seniors really has helped, I think, mitigate the spread of the virus, because we know that patients still need care. And arguably, telemedicine and telehealth is important for the long term, because I think patients and doctors are recognizing the convenience of it and how it may not fulfill every need, but it certainly does fill some. And increasing access to care may actually promote health and keep people out of the hospitals and healthier over the long term.
Sima, I want to take that a step further, because I'm really enjoying doing a lot of telemedicine visits myself right now. Can you see a future where, if we're talking about COVID-19, where the senior has a pulse oximeter, let's say, that will tell me their oxygen saturation, which is important, or, where they can take their own blood pressure or get vital, where I can expand the access to information incoming from the other end if we continue to cover telemedicine visits as we go forward?
Yeah, I think that makes a lot of sense. I mean, what you're also talking about is remote monitoring, and we've started to pay for those types of services as well. I mean, the reality is we are adding 10,000 new Medicare beneficiaries to the program every single year, and we have to make sure that we can deliver high-quality health care. And so doing things like telemedicine, remote monitoring allows us to augment the services that we provide. It allows us to use our workforce more effectively. And I actually think it's going to improve health outcomes for our patients.
Talk to me about nursing homes and the special challenges we're facing trying to help patients in nursing homes during this period of time.
Well, first let me say that our hearts and minds just go out to the patients and their families. This has just been an enormously difficult time. As you know, very early on, the Trump administration recognized the particular vulnerabilities of nursing home residents, because they're elderly, they have underlying health conditions, and they're living in close quarters. And so very early on, even in February, we were working with nursing homes, asking them to double down on their infection control policies. We put out recommendations about not allowing visitors into the nursing home and screening those people that come in. We've been putting out new guidelines, new recommendations almost on a regular basis, because we work with CDC almost daily to make sure that nursing homes have the information that they need. And, quite frankly, we've seen some good work by governors that have taken a leadership role in supporting their nursing homes. So there was one governor that had the National Guard go in and clean all the nursing homes. The governor in West Virginia has called for testing in all of the nursing homes. In Massachusetts, Governor Baker has actually set up COVID-positive nursing homes to isolate patients so that those that aren't showing symptoms, aren't at any risk. And Governor Hogan in Maryland has developed strike force teams where they go into nursing homes that are having problems and make sure that they have the staff that they need. But we've got to continue working with nursing homes to make sure that they are adhering to those guidelines and recommendations that we've put out there about how they can keep patients safe.
Seema, you're getting into an area that's been very political, so I want to kind of keep it to the medical side, but I want to rely on your background as really, I'd say, health czar in Indiana under then Governor Pence, and now running Medicare and Medicaid services. There's been a lot of back and forth about the issue of the role of the federal government versus the states, and you just kind of highlighted some of that, but keeping in mind that, of course, this is a national emergency going on. What challenges have you faced in trying to integrate healthcare between the federal government and the states?
Sure. We'll give you some examples of how I think it works and how it should work. So at the federal level, we're using the science, we're using the data, and we're putting together recommendations, regulations, requirements, guidelines, and resources for states and for local governments. But if we take the example of nursing homes, right, I can put out these regulations and these guidelines. I've also taken the army of inspectors that we have, 8,000 of them, and said, I want you to go into the nursing homes and see how they're doing around these infection control guidelines. But at the end of the day, it took the governor saying, hey, we're going to go out and test these nursing homes. We're going to get one of these point-of-care tests, put it in a car, and drive around to the nursing homes to make sure that we're testing both the patients and the healthcare workers. That's the difference between what the federal government can do and what the state government can do. I can't drive out to a nursing home in West Virginia, but the governor in West Virginia can make that happen. What we do at the federal level is give recommendations. We say you really need to have a testing plan for your nursing home. So we're giving them recommendations, we're giving them guidelines, but at the end of the day, it's up to them to implement them. And in terms of nursing homes, states license these nursing homes. So we can go in and do an inspection, we can highlight, identify problems, we can find them, and ultimately I can withhold reimbursement. But the licensing and their ability to even exist in that state is really, that decision is made at the state level. So it does require all levels of government working together, but that on the ground is really important. At the end of the day, it is federally supported, state managed, and locally executed.
Here's a fact that I only know because I was involved in hurricane coverage and disaster coverage and interviewed HHS director, and I interviewed Alex Azar during this period of time. But it's that Medicare has information that's private, but that under a state of national emergency, when FEMA is involved, that information can be used to save lives. You know who's the vulnerable population, who's at risk, to get out to them and to intervene if they're in trouble. Is that happening here? Is that a useful angle on this emergency?
Absolutely. One of the things that we do when we work with FEMA is we identify our vulnerable patients. So in particular, individuals on dialysis, because we know that no matter what's going on, whether it's a disaster, a pandemic, a hurricane, people that need dialysis, that's something that they need, every other day. And we need to make sure that they have access to services or medical equipment. It could be, who's on oxygen. In this case, in terms of the pandemic, actually Medicare data has been very important to our surveillance efforts. Medicare data is actually the backbone of some of